Shipment of face masks and other PPE bound for Baystate Medical Center was almost seized by the FBI and Homeland Security. 22 News reporter Hector Molina spoke to one of the doctors who was in charge of that shipment.
Chief Executive Physician Dr. Andrew Artenstein told 22 News that the process to get PPE usually moves like clockwork, a very easy thing to do. But due to the unprecedented times that we're living in now, Dr. Artenstein and his staff at Baystate Health had to deal with China and the FBI in order to get PPE to fight this COVID-19 pandemic.
It was highly unusual, a little surreal, but at the end of the day, it's what you have to do.
Dr. Andrew Artenstein, Chief Physician Executive at Baystate Health, has been working in healthcare for more than 30 years. He told 22 News he has never seen the supply of personal protective equipment run so scarce. The supply chain professionals at Baystate have expanded from a small group to a group of more than 24 that works countless hours to find the safest PPE for hospital staff. After dealing with multiple suppliers, Dr. Artenstein and staff at Baystate came across a supplier who, quote, was from an acquaintance of a friend of a team member. The supplier, who Dr. Artenstein said has a credible reputation, was carrying Chinese KN95 masks and respirators similar to the function of N95 equipment used here in the United States. Hundreds of thousands of masks and respirators of PPE was sent from the supplier to a warehouse in the mid-Atlantic region of the country, according to Dr. Artenstein. Then, the FBI received word of this transaction and took a closer look.
Across the country, where agents were fanning out and going to places where they were, where PPE was being purchased to ensure that these shipments were headed to hospitals or first responders. That's what the agents told us.
The total shipment included more than 500,000 PPE that will be distributed among all Baystate Health facilities. Dr. Artenstein said this experience shows how difficult and important it is for healthcare workers to have the proper equipment.
Whatever we need to do, uncover, as I say in the paper, leave no stone unturned to get this material to provide the safety and protection and peace of mind that our healthcare staff needs to do the work that they're willing and able to do.
Now, we asked Dr. Artenstein just how long this equipment will last the workers here at Baystate Health, and he said just a few months, what he describes a best-case scenario. Working for you in Springfield, Hector Molina, 22 News.